Welcome back on a Thursday to News Channel 3 Live at 5. I'm Andy Dominiani.
I'm Kate Tillotson. If someone is having a stroke, doctors say time is brain. And now patients have more time to get help.
Yeah, and tonight's Doc Talk, News Channel 3's Erica Moke tells us what's changed, allowing some patients to receive care up to 24 hours after showing signs of a stroke.
When someone has a stroke, care needs to follow almost immediately.
Time is brain, so the faster you can get to the hospital, the better you are.
For years, patients only had 3 to 4.5 hours since they were last known well to get a potentially life-saving medication. But in 2015, thanks to plenty of data and research, the American Heart Association expanded that window to 6 hours, as well as recommend a type of procedure that for years was considered experimental. Dr. Derek Kreidel says some patients can even get that procedure up to 24 hours from the onset of stroke.
These patients cannot even be a candidate for the clot-busting medication, but they're still a candidate potentially for the catheter-based therapy.
Taking care one step further, doctors at Broadens are also taking advantage of this new state-of-the-art CT scanner.
This is a patient with normal brain perfusion.
This scanner helps doctors determine if there's brain tissue that can be saved and how to proceed in the best way possible.
Recently, 2 weeks ago, I did someone that had been 22 hours since the last time they were known well, and the patient had dramatic recovery in their deficits. And what it was is that what the scanner showed me is that there was only a relatively small area of permanent injury and a very, very large area of the brain that was still alive but not receiving the proper blood flow, and so it was just not functioning appropriately. Everybody's a candidate until proven otherwise, and we will do whatever we can from an imaging-based standpoint to determine whether or not they may potentially be a candidate for advanced therapy.
So yes, having that additional time is extremely beneficial, but Dr. Kreidel says if you think you're having a stroke, do not wait to get help. The faster you see a doctor, the better the chances of a good outcome. For Doc Talk, Erica Moke, News Channel.